You are going to pry my zofran out of my cold, dead hands during all 3 of my pregnancies when I threw up every single day. But for the most part, zofran isn't our first-line treatment when it comes to managing nausea and vomiting of pregnancy. We have a whole algorithm that walks us through the treatment of nausea and vomiting of pregnancy, and after lifestyle changes fail, like eating crackers and eating small meals, we start with medications. And you can see that we have to get through several different steps until we get down to zofran. And the reason for this is that there were some studies that showed that there was an increased risk of congenital anomalies like cardiac defects and a cleft palate when the pregnant patient took zofran in the first trimester. But there were also studies that showed no association between the medications and those defects. For the studies that did show that increased risk, though, the absolute risk was very slightly above that baseline risk, 0.03 for cleft palates and 0.3% for cardiac defects. That's why in the first trimester, when your baby's organs are forming, we try to avoid those medications if we can use other medications that work. The fetal heart is developed by 10 weeks and the palate by 12 to 13 weeks. So especially when you're beyond that point, taking zofran is considered very safe. And if you're prior to that point and your nausea is not managed or you cannot tolerate those other medications, zofran is still an option as long as you understand the risk and benefits. And as an expert zofran user, please use Miralax daily because that constipation will get you.